Here's what raises cholesterol. You need to know what raises it. It's simple. And again, most of your doctors don't even know this. It's saturated fat. What's saturated fat? Well, it's real simple. It's butter, it's cheese.
Hey, Kyle Colbert here, and this is Dr. Colbert's broadcast, and I'm here with my mom, Mary Colbert, and my dad, Dr. Don Colbert, and we are talking about your number. There are over 12 numbers, and you need to know these numbers if you want to live long and strong. So far, we've gone over high blood sugar, high blood pressure, weight, and waist measurement. What's the fifth?
Okay, the fifth is know your cholesterol, your total cholesterol, your LDL, which is your bad cholesterol, your HDL, which is your good cholesterol, and your triglycerides. Know your numbers. What should the numbers be? For the total cholesterol, it should be less than 200 milligrams per deciliter. For LDL, it should be less than 100 milligrams per deciliter. For HDL, the higher the better, I tell people. And for triglycerides, it should be less than 150 milligrams per deciliter. Those are the key numbers we got to get
Now,
to.
into layman's terms, when you say 100 meters per deciliter, it's just when you get your blood report,
Right.
it should
It'll
be
say-
under 100.
It should, yes, your LDL should be under 100. It shows it as milligrams per deciliter, but less than 100. That is the key.
Now, one thing I want to add here real quick is many people will go to their doctors and they get their blood test, and the doctors many times gives you a false report. And I'm being honest here because they're busy or they don't really want to take time to explain. And you could be just a little bit high and they'll go, it's okay, it's okay, it's okay. No, you do not want anything a little high.
Yes.
You want to work on bringing it down.
Yes,
This
you
is
do.
going to be very important that you understand this, because I am really annoyed by the doctors who have, because we're going to go later into the numbers on talking about thyroid and ones, and people will hear, oh, it's not that bad, that number's okay, you're kind of in range. And it's like, folks, we want to stress to you, you need to know what it really should be. And if you know, my people are destroyed for lack of knowledge. But if you know, then you don't have an excuse, because that's what this show's about. That's what this series is about, living long and strong, is understanding your numbers and what they really should be.
But what's so important is this. When you have multiple numbers elevated, these are additive or exponential. In other words, if your blood pressure's high, your blood sugar's high, your cholesterol's high, your triglycerides high, your C-reactive protein's high, your homocysteine's high. Now I'm getting ahead of myself. But if all of these are high, your waist measurement's high, these are additive.
It's a recipe for early death.
Exactly. You are signing up for disease.
Yes.
You are on a warp speed course for disease. And you're not going to live long. You're not going to live strong. You're going to live disease. So we got to get these numbers down. Now, again, it's so easy to get these down. I've explained it so simple in my book, Beyond Keto, which should have been called Beyond Keto Zone. It's the healthy Keto Zone diet. When you follow this diet, here's what raises cholesterol. You need to know what raises it. It's simple. And again, most of your doctors don't even know this. It's saturated fat. What's saturated fat? Well, it's real simple. It's butter, it's cheese, it's whipped cream, it's sour cream, it's all the saturated fats such as bacon, sausage, fatty red meat, pizza, ice cream, coconut oil.
Coconut oil?
Yes, coconut oil. All of these are saturated fats. When you eat a lot of these, it's going to raise your total cholesterol and your LDL. And it's not going to raise your HDL. There's nothing that really raises HDL except for aerobic exercise. Men, your HDL should be over 40 milligrams per deciliter. Women, yours should be over 50 milligrams per deciliter. But there's hardly anything that raises HDL because it's genetic. And so maybe a little exercise can raise it just a little bit, but it's not significant. So again, if your HDL is low, don't worry about it. Work on getting your LDL down. Work on getting your triglycerides down. Don't worry about it. But the key thing is saturated fats. When we lower saturated fats, it's so easy to do too. Follow the Keto Zone diet, and we give you extra virgin olive oil, high phenolic, which is low in saturated fats. It's high in your oleic acid, which is not a saturated fat. There's minimal amounts of saturated fats in it. Avocado oil is high in monounsaturated fats. Avocados, nuts and seeds, they're high in fiber. So the fiber lowers cholesterol.
You know, what's amazing is we just found out.
Soluble fiber
yeah.
lowers cholesterol.
We just
Yep.
saw a study. It came in, and so every night, your dad and I, we've been
Right.
this, a handful of walnuts. They have found
Lowers the risk of colon polyps. A recent report shows that. And so again, nuts are great. Seeds are great. Pumpkin seeds, men, for your prostate, pumpkin seeds are wonderful. That's what I snack on at night. Walnuts, I call them Wallies. I need my Wallies. And then my pumpkin seeds. I love my pumpkin
salted,
seeds.
the roasted
Kills
pumpkin
parasites
seeds.
too.
Oh, it does
It
kill
kills
parasites.
parasites,
Absolutely.
right.
So again, it's so simple to lower cholesterol. Number one, fiber. So I take my fiber zone at night, especially if I ever eat any red meat. I take a heaping scoop of my fiber zone, either the berry or the key lime.
Now, what foods are high in fiber? I
Well,
know we talked about
berries are high in fiber.
All your fruits.
Your vegetables like broccoli and foods like that. Beans are high in fiber as long as they're not baked beans. They're still raise your blood sugar. Peas, hummus, chickpeas, garbanzo beans. Those are real
all your
raw fat
salads,
foods.
Are
all
there
your
certain breads that are high in fiber?
Well, breads are high in fiber, but you're getting the wheat, and wheat's highly inflammatory. That's something that's going to pack the pounds on you. When you're eating wheat, you're getting gluten, you're getting gliadin, you're getting inflammation, you're getting wheat germ agglutinin, which is causing weight gain. And wheat germ agglutinin binds to that insulin receptor and causes weight gain. So I try and get most patients off the gluten because the gluten is going to prevent weight loss and it's going to create more inflammation. See, there's key foods that create inflammation in our bodies, which contribute to belly fat and weight gain. And the worst is gluten or wheat. It's also in spelt, those other grains. But wheat is number one, dairy is number two, eggs, and then soy, and then peanuts, and then tree nuts, and then fish and shellfish. Those are your main food allergies. Over and over, we see those over. Now, there's others, but those are the key ones we see. But the first thing you do is you lower your saturated fats. Then you increase your fiber, and with the nuts and the seeds and the fiber zone. Your berries are high in fiber. Now, again, some beans, if you eat too much beans, it'll throw you out of the keto zone. But also, you want to consider your plant sterols. What are plant sterols? These are natural elements that bind the saturated fats, such as cholesterol is one you can get over the counter, or we have one at the office we sell called cholesterol, spelled just like cholesterol, but instead of the CH, it's cholesterol with an F. And these are plant sterols that bind that saturated fat. So if I go out and if I have, say, a burger or a steak, which I rarely do, or bacon, which I rarely do, I'll take 2 of my cholesterol capsules. And it binds the saturated, then I'll follow that with my fiber zone. So it binds the saturated fats and the fiber sweeps it out of your body.
Now, aren't there two forms of, I know we have HDL and LDL, but in the LDL, doesn't it branch off and there are two
Yeah,
forms?
there's subfractions. So we do, actually, you have different LDLs. So I can do an NMR lipoprofile. We're not getting into all that. We're getting into the weeds and people turn us off. But you have the small density LDL. You have the oxidized LDL. These are highly atherogenic. They cause a lot of plaque. And a lot of my patients, I check these levels on them and get them down to normal, but this will bring these levels down to normal also. So how do we lower cholesterol? Keto Zone diet, lots of fiber, plant sterols, and there's another supplement that helps called red yeast rice. It's dirt cheap. You can get it over the counter. Most health food stores are online. And you can take usually 1,200 to 2,400 milligrams a day. Some people only need 1,200. Others need 2,400. Start with 1,200. Rarely it can stress the liver, but most people it doesn't. But I check the liver test, and liver is one of the key things too in our 12 numbers. But we check the liver about 3 months later to make sure it's not stressing the liver. It generally doesn't, but that lowers cholesterol for so many people.
Now, some people have genetic issues with
Yeah,
cholesterol.
and that's true. Some people have familial hypercholesterolemia, and for those people may need Repatha. Some need a statin drug. Statins, like I use low-dose statins, like I'll use such as rosuvastatin 5 or 10 milligrams a day. Some people will use Zetia, which is ezetimibe, which 10 milligrams a day, which is not a statin, but it lowers cholesterol, and it's not toxic to the liver, and it doesn't cause that muscle pain and weakness like so many statins do. But statins do work. They do lower cholesterol. So many people are against statins. Some people, they have familial hypercholesterolemia, should be on one or an alternative like Zetia or Repatha or one of those other meds.
What are some of the side effects that you see associated with people taking the prescription cholesterol meds? Let's say they're not genetically, they're not predisposed to have high cholesterol through genetics. What do you...
Doctors are prescribing a lot. The good news is, well, I see side effects like muscle pains, muscle aches, joint problems. I saw one patient just last week that developed tremendous muscle problems, shoulder problems. He had to have a shoulder surgery because it affected his joints so badly. So a lot of joint pains, a lot of fatigue. It lowers the coenzyme Q10 levels. So anyone on a statin needs to be on CoQ10 at least 100 milligrams a day. It causes a lot of diabetes. It raises the blood sugar. So people on high-dose statins, we have to watch their blood sugar because a lot of people are becoming diabetic when they're on the statin meds and no one's watching their other numbers. You got to watch all the numbers.
What would you recommend someone do who's isn't able to come see you and they're on a prescription and they don't want to just go cold turkey on a prescription and start consuming high-fiber foods? They want an expert. What should they do? Should they have that conversation with their doctor?
Well, doctors won't know. They know very little on nutrition. What I would do at first is I'd start our Beyond Keto diet. This is a low carb. It's really low in saturated fats. I would do that. You need an oil change. So I'd start the Beyond Keto diet. I'd start on the fiber zone. I may start some plant sterols like cholesterol, CHOLESTOFF, over the counter, or forresterol. They're plant sterols. They work naturally. They don't put any stress on the liver. They go through, they bind the saturated fat, they escort it out. I add another layer, which is our fiber zone, which will help push it on out of the GI tract. So that lowers cholesterol beautifully. It doesn't stress the liver at all.
Should they test their cholesterol at the beginning of this?
Yes, absolutely.
Maybe 36 days later? What's your recommendation there?
Well, usually we check the cholesterol initially and then 3 to 6 months later, usually 3 months later, because it usually takes at least 2 months for it to work, and we add an extra month. And then we also check the liver. If some people do need a statin, so I'm not against statins. One of the main reasons we're seeing so less heart disease and heart attacks is because of so many statins being prescribed over the last 20, 25 years. They have reduced the incidence of heart attacks and heart disease. So statins do work. They decrease inflammation. They do lower the bad cholesterol. But again, there's potential side effects. It's a double-edged sword. So again, you've got to be aware there are other options, and most doctors aren't aware of these other options.
So they can check their cholesterol and then check it 3 months later. And then if it's working and they're seeing it drop, should they then check it yearly or?
Every 6 months. You need to check it every 6 months. Now, again, a lot of my patients, I have them on just our fiber zone, on our Beyond Keto diet. Some are taking the plant sterols. Some are taking the red yeast rice. One red yeast rice I like is called Choleast, CHOLEAST, 1 or 2 a day. And that's a very effective one. So again, it's finding the things that work. And then when you do this and put everything together, you got to decrease that inflammation, got to lose that belly fat. As you're doing that, you're also going to reduce other risk factors, which will help you prevent heart disease.
And these are blood tests that they will just get at their doctor. They can go to their doctor.
You can go every doctor is going to recommend these blood tests. I can guarantee
this is just a...
Now, that's just for cholesterol. We've not even talked about triglycerides. This is equally as important.
Are we going to talk about triglycerides?
Yep, then we need
Well, let's talk about it.
Well, high triglycerides are associated with heart disease. And when your triglycerides are greater than 150, more people are more prone to heart disease with high triglycerides. And doctors say, oh, that's not a big problem. Triglycerides are a major problem because they start to cause that plaque buildup in those coronary arteries. What high triglycerides do is they cause pancreatitis. They're associated with type 2 diabetes. They're associated with metabolic syndrome and fatty liver disease. So high triglycerides, you know how we get high triglycerides? First of all, we get high cholesterol from saturated fats. We get high triglycerides from sugar, refined carbohydrates, excessive sweets, and desserts. and white breads, the processed breads, the white rice, all the whites, I call it, the white potatoes, they spike the blood sugar, they raise your triglycerides. And most doctors don't even know that, but you especially get it from sodas. Also, get this, honey.
Honey.
Honey will cause high triglycerides, also fatty liver. Anything that spikes the sugar like agave nectar, maple syrup, sweet fruits, any dried fruits, raisins, dates, prunes. People are eating these dried fruits, it's spiking their sugar, it's driving their triglycerides up, and their doctors aren't even knowing this and not even mentioning this. But also other sweet fruits, which are grapes, are high in sugar, mangoes, papayas, oranges, ripe bananas, they're high in sugar. Apples are okay as long as they're low glycemic apples. There's some apples that are
Granny Smith apples?
Granny Smith are great. They don't spike the sugar. Those are wonderful. And they have that
Crisp is good too. That's another one.
So again, all I'm saying is moderation. The best are your apples, your Granny Smith apples, and not the grapes. Also your berries, your lemons, your limes, they're low sugar. If you're going to eat bananas, eat the green bananas. When they turn yellow, give them to the
Now,
kids.
but to qualify this, what he's saying is if your blood test and your cholesterol, your triglycerides, you're one who is severely elevated.
Greater than 150 milligrams per deciliter.
Okay.
You're in trouble. Warning.
You have to do some extreme things. You've got to cut some things extremely out.
You do.
Okay. Now, if you're the person that come in and yours is low and you're moderation.
Yeah.
You can have a little bit of
true.
honey here and there. You can enjoy a little things, but it's what happens is the people that do it every day. You're doing this every day. It's every meal. You're going to get in trouble. You're going to get in trouble.
You're right. You will get in trouble. You follow my Keto Zone diet, I'll show you what to do. But if you can think of it this way, if your cholesterol's high, it's a saturated fat. It's the butter, the cheese, the cream, the red meats, the pepperonis, the processed meats, the coconut oil. A lot of people cooking with coconut oil. Cook with avocado oil. It's got a higher smoke point at 570, and it's monounsaturated. It's not going to raise your cholesterol.
Now, if someone's triglycerides are low, is it possible for their cholesterol to be high?
Yeah, absolutely.
LDL
You can do
high?
that. Yeah.
Okay.
But if you have both high cholesterol and high triglycerides, you're in trouble. That means you're eating usually too many saturated fats and too many sugars, carbs, garbage, and starches. Those refined carbs are the worst. It's the whites. It's the white rice. It's the white bread. It's the pasta. It's the tortillas. It's the potatoes. These spike the sugar, and they're just like eating sugar or sometimes worse.
Now, you said something to me years ago and always stuck with me is when a man has a belly, if it's soft, it's because he's been eating a ton of sugars and cakes, and so that's bread he's been consuming. But if it's really hard, they're red meat eaters.
They're usually red meat.
And that's the
Think of a cat, think of a sow, a pig. That pig's belly is full of that saturated fat. When you're eating a lot of ham and bacon and sausage, you get that old bubble wrap fat where literally I'd see a guy with a big old belly, and that could be beer too, but they'd have a belly full of saturated fat, bubble wrap with saturated fat.
Soft.
You can't even pinch. No, you can't even
that's
pinch
hard.
an inch. It's hard, but it's that soft, doughy fat. That's the sugar and the carbs and the starches, and usually their thyroid sluggish or low. We'll talk about thyroid
We're going to
later.
get into the thyroid, but this is great.
This is a fascinating show. I'm learning a ton. I'm sure you're learning a ton. And so, Dad, I'm excited about the next program. We have gone over 5 numbers. And so we want you to know your numbers. So far we've got high blood sugar, high
blood pressure,
weight, waist, and high cholesterol.
and triglycerides, high triglycerides.
And so we've gone over 6?
Yeah,
Or
well, that's part of
one?
cholesterol.
That's
Okay,
part of
right,
cholesterol.
Okay. If you are enjoying this show, please make sure you like, subscribe, join us on YouTube or any of our social media platforms. If you have further questions, you can go to drcolbert.com. You can email us at info@drcolbert.com. We'll see you at the next program.